So I wanted to ask, what trend are you keeping your eye on right now and why?
Obviously, myself and just about everybody else here has got to be paying attention to the artificial intelligence and the whole generative AI space. This is one of those things that it's got an opportunity to absolutely transform healthcare and or really create a lot of problems. As was pointed out this morning at the keynote, there's a lot of risk that we can run into with this if we don't properly train the AI that's out there. But it's going to define healthcare in the future.
Sure. Well, certainly ransomware is one of the top trends that we're keeping an eye on. It's been a problem in healthcare for many years. It's actually doubled in terms of number of occurrences over the last 5 years. And ransomware is really a concern for healthcare more than any other critical infrastructure industry, according to the FBI. I think what we've seen over the last couple of years has been an increase in not only the number of records that are breached in healthcare, but also just the disruption that's occurred to hospitals and healthcare providers. And ultimately, that's a challenge for patient safety and clinical outcomes. So it's not all bad news. There's some good news out there as well. And we're seeing organizations that are responding very well to some of these challenges. They're really doing enterprise level risk analysis, but they're also looking at their more specific investments in certain technologies and information systems, getting to that next level and really protecting their businesses in a way that they need to ensure that these threat actors aren't causing them harm and causing their patients harm.
And what trend are you keeping your eye on right now and why?
So there's a lot of options there you can go through, but I think to me, and someone that's worth Cox business, we're a non-traditional healthcare company. We've been decades-long service of healthcare, but I think when you look at the grouping of companies that don't come from a provider or payer background, the continued emergence and entrance of those non-providers, the big technology companies that we all know, the Microsofts, the Googles, the Amazons, and we see the big wireless carriers, even the big cable companies like Cox. So I think that's a trend to watch as these non-traditionalists continue to come into the industry and offer products and services to help the industry digitally transform. It's pretty intriguing.
So what trend are you keeping your eye on and right now and why?
Really, as we think about the healthcare industry today, one of the main things that is really fascinating and interesting to us is really the quest for optimization around a healthcare flow system, particularly because there's a significant trend of providers, doctors and nurses complaining about burnout. I think the American Medical Association pointed out that approximately 60+% of physicians actually indicated last year that they were really burnt out. There were trends of burnout and they were complaining about burnouts. And this is almost doubled because pre-COVID, it was a significantly less number, below 40%. And this is basically trending to show that the process of managing health in the hospitals, in care centers, is getting more complex, more complicated, and nurses and doctors are really burning out. And so there's a big trend in terms of enabling and optimizing the flow of healthcare across different segments and industries or segments within the healthcare industry.
Well, we came to HIMSS this year with looking at a couple of different trends that we're very interested in. First, interoperability. There's a lot of discussion about FHIR and the early implementations of bulk FHIR in particular. So we've been really intrigued to find out what's happening in the industry around bulk FHIR. We're in the population health management space, and so bulk FHIR would be a huge benefit to us, and we're really pleased to learn more about what's going on in that space. The second thing that we're really, really interested in is what's happening in the industry in health equity. We're heavily invested in health equity, and we think that this is the next major step in terms of value-based care. The reason is those patients that are out there that are both socially vulnerable and medically compromised are some of the most challenging from both quality of care and outcomes perspective, but also financial and utilization perspective. So health equity is another theme.
Many trends. We've been in healthcare for a very long time. One biggest trend which we are seeing is a move to the digital transformation to enable patient engagement, which is a very big trend, which could be digital front door for payers. It could be patient engagement or physician engagement for some of the health tech companies or for the medical device companies. So we are helping some of our clients do that. The other trend which we are seeing is the focus on clinical decision support and there are many organizations who are using the existing data, interoperability to enable clinical decision support on specific use cases, which will help them to better serve their patient and give them better outcomes. The third theme which we are seeing is more around intelligent automation using AI and machine learning. And here the automation is more around the existing healthcare workflows, where we are helping some of our clients enable AI and machine learning in their existing workflows. So these are some of the trends which we are seeing over the last 2 to 3 years.
Can you tell me what trend are you keeping your eye on right now and why?
Well, we're a medical NLP company at Emtelligent, and so the trend we're keeping our eye on is large language models in understanding medical text. It's going to revolutionize levels of accuracy in what we do.
Really the AI trend. And the reason for that is, obviously it's super important and it's being used more and more. But as it continues to be used and as we continue advanced AI, there's going to be an ever increasing demand for more data because you need data to feed those AI models. And with that, it's going to be more important that you figure out how do you get that data and how do you do it at scale. So again, it's going to be super important to understand how do you change all of your data operations so that you can do it safely, protecting PII, but also do it at scale.
And what trend are you keeping your eye on right now and why?
So one of the things that I'm looking at and very interested in for PointClickCare is the work that's going on in IHE around the 360X specification. And that's really building on the work that's going on in national networks and exchanging CCD documents that I've been involved in for the last decade and more. And using that to cover sort of the whole gamut of care that happens from ambulatory to acute to long-term post-acute or rehab care, and making sure that whole loop is closed. So that's an area that's of deep interest to me and to our customers.
Main trends that we're focused on are interoperability and accelerating clinical data exchange between payers and providers. As you know, payers and providers are two big constituents within our healthcare ecosystem. And how do you make sure that those two ecosystems or constituents can exchange data in a frictionless, high fidelity, and secure and compliant manner to drive better patient care and patient outcomes?
There's a lot of trends, but I think one of the most significant trends, in my opinion, is COVID really, brought so many technologies into healthcare. I think a lot of companies and a lot of health systems and health plans are taking a step back to really reevaluate their strategy and to kind of take a look at which ones are bringing value, which ones are not. And I think they want to really consolidate and settle on one platform or fewer technologies, but really focus on the value and the outcomes that those technologies bring.
There's a few things I've been out looking for on the floor, and it really goes back to why I got into this business and what I'm doing today. So I'm a nurse by background, and I spent many, many years in health IT. I love this business. I can see what we can do for our patients. So there's a couple things I've been eyeing. I recently became a new grandma 2 weeks ago, and my new granddaughter had to spend 2 weeks in the NICU. So I'm out there looking for those kind of systems that could facilitate her going home sooner and having providers on the other end really know what's going on with her and being able to provide her care. So it's very personal to me what is going on out here and how we can make a difference in the patient lives that we serve. The second thing I'm looking at is, again, I have an elderly mom, and she's still in great shape. She's living at home, but she's a bit lonely, and you've got to watch out for her care all the time. So what kind of tools do we have out there in our healthcare IT environment so that it can help me as that daughter know what's going on with my family members, and again, providing them the best patient care that they can get to.
What trend are you keeping your eye on right now and why?
Yeah, sure. So to me, it kind of ties back to that early encounter, and it's around behavioral health. So if I look at our organization and our focus, one of the things that we're starting to see is a continued reduction in staff across the country, especially with behavioralists. I think there's roughly 66% to 70% of the counties nationwide that don't have adequate behavioralist resources. And so being able to engage with telemedicine and bring those professionals early into an intervention can only help keep people at home or in place and manage behavioral health without criminalizing or institutionalizing it. So that's really the trend I'm looking at today.
Yeah, so tell me, what trend are you keeping your eye on right now and why?
Well, this morning I walked down the HIMSS floor and I heard ChatGPT 5 times. I think that's the hottest trend in technology right now. But we also are seeing a number of different trends in healthcare in general. One is that there's a lot of push towards interoperability using the HL7 FHIR API. And there's also a lot of regulatory pressure now to do that. So I think that's going to really change the game in a couple of years. Yeah.
I'm paying a lot of attention to the nursing shortages. I think there's a whole lot of how do we do more with less, because you can't ask nurses to be more productive. They are giving you everything they have today. So finding ways to centralize care, offer more self-service, patient self-service, and then looking at virtualized nursing, just different ways that we can provide a break to the nurses that do such important work in the healthcare industry. That's one that we continue at Zoom to figure out ways that we can improve the opportunities for nursing.
So one of the things that we're starting to see in healthcare with our customers and with other healthcare organizations that we talk to is really the desire to focus on a more coordinated patient experience. A lot of vendors or providers are struggling right now to kind of cobble together consistency in the patient experience. And there's really a lot of focus on making sure that they can engage with their patients in a way that's familiar with them, that makes them understand that they know them. And the best way to do that is really through kind of consolidating those multiple applications. So we're really starting to see that happen in a meaningful way where providers are looking to reduce the number of vendors that they're interacting with so that they can, one, build efficiency in their organization, reduce integration costs, and build a better patient experience that's more consistent.
And what trend are you keeping your eye on right now and why?
Oh, wow. One of the biggest trends, I think, right now, we all agree, it's AI, generative AI, and really where we're going with it. And I think it's got a lot of huge benefits for, helping processes, whether it's patient intake, whether it's just anything that we can automate is going to be easier. But I think what we forget about is some of that automation can also maybe not be done for the best reasons. And the more you automate and generate, bad things can happen. And also the hackers are also taking advantage of that same AI to harvest information that's available. So I think it's something that it can be extremely beneficial, but it's something we do need to keep our eye on and be aware of it.
Definitely. And what trend are you keeping your eye on right now and why?
Well, we know analytics and AI is constantly something that is up and coming, but I would really say at HIMSS 23, we're really starting to see some of the larger health systems start to make progress around AI, and that's exciting because we know in healthcare, 95% of the data is not really used, and we're not utilizing the data that we're capturing. So how do we make use of that data to improve patient outcomes? So I'm really excited about AI and how we're going to carve a path forward in healthcare with that.
So what is interesting with healthcare is that there is an aging population going on. At the same time, there's a shortage of caregivers, especially nurses. And like all the predictions says that there will be a gap going forward and it will be bigger and bigger. So it means that something has to help to free up time for the caregivers so the nurses can have more time with the patient. And that's the trend we are really looking into it to see what can we do with our technology to ensure that it's happening.
I'm really excited about the social determinants trend right now. I think you're starting to see the government start to fund it. I've heard that a lot at this conference at HIMSS this time about how there's actually people looking at ambulance transports and food deserts. And before it was like, yeah, that's a buzzword like blockchain or other things, but it's really seeing some actionable insights this time. And I think we're going to see some change.
So one of the biggest trends that we're seeing is improving access to quality of care, creating a equilibrium in access, whether it be an economic equilibrium or an equilibrium as relates to diversity and inclusion. We are very keen on looking at technologies that make sure that all patients, regardless of demographic, socioeconomic circumstance, or gender have access to world-class cutting-edge care. It should not be care only available to those that can afford it, but something that is more universal in nature. So we're very keen on looking at solutions, particularly in digital health, that really does create an equilibrium for patients in terms of access, in terms of at-home care, and also personalized medicine as well in pediatrics.
Great.